Thank you very much, Chris. It's a real pleasure on behalf of the Maine Medical Association to welcome you along with Chris. This is our second collaboration with the Maine Health Management Coalition. Last year, many of you were with us, and when we had the program right in this room and had Dan Heath, the business author, speak. This year we've got 340 attendees registered. We're very pleased with that, and hope that you have a great day with us. The only announcement I really have is that if you are interested and need continuing education credits, CME for physicians and some other things for the rest, for many of the other professionals in the room, see Gail Began from my staff at the registration desk, and Gail will take care of that for you. So other than welcoming you here, and I only have the pleasure of introducing our first plenary speaker. I think actually we might have had your sister introduce you last year, but Dora took so long that there was an occasion at Augusta Kiwanis where I was introducing my brother, and I talked longer than he did, and he hasn't let me introduce him since. But I have the pleasure this morning of introducing Maine's Attorney General, Janet Mills. She is a native of Maine, was born in Farmington, graduated from the University of Massachusetts and got a law degree from the University of Maine. She was the first female district attorney in New England, and I think served maybe 4 terms as district attorney. She's just serving her 3rd term as Attorney General, which, as most of you know, is elected by the Maine legislature. We've had the pleasure of, at the Maine Medical Association, of doing a lot of collaborative work with Attorney General Mills on the opiate problem. I know that she's going to talk about that this morning. I remind those of you who were here last year, and will comment briefly for those of you who weren't, that last year Janet gave just a terrific talk about her experiences with her husband in Maine's, trying to find their way through Maine's healthcare system, and after stroke. And it was really powerful speech, and many of you related to that. She was the most highly rated speaker that day. This talk this morning is a little different. She's really more that was really more of a personal talk of her experience, and I think we all felt that, my goodness, if the Attorney General of the state, as accomplished as she is, can't find her way for her husband through Maine's healthcare system, then we've got to do better. And that's why we're here. Every one of us and every one of you strive every day to make Maine's healthcare system better for patients. And so I think with that brief introduction, it's my real pleasure to introduce my friend and Maine's Attorney General, Janet Mills.
Thank you, Gordon, and thank all of you for inviting me to speak to a very distinguished group. Think about doctors, and I forgot to have a physical for a couple of years. I finally realized it was time, so I went last month, and she noticed my weight. She refused to believe that I worked out. I couldn't fit, but I did list the exercises I do every day just in my job at the State House. I told her, I jump to conclusions. I climb the walls every time the phone rings. I drag my heels. I push my luck. I sometimes make mountains out of molehills. I bend over backwards. I run around in circles. I put my foot in my mouth. I go over the edge, and I beat around the bush. I say I get my exercise. Of course, that's nothing compared to the exercise the governor must get every day in his office. I want to thank the Maine Health Coalition, Management Coalition, for its commitment to high-quality, affordable health care in Maine, and its goals of improving the health of our population, of reducing per capita health care costs, and ensuring quality and satisfying care. I know you're interested in health data, so I want to talk about the data surrounding the biggest health challenge of our time, the opiate epidemic. My office sees the effects of opiate abuse every day in nearly every facet of our jobs. In advising professional licensing boards and prosecuting disciplinary actions, we're seeing drug diversion and drug use by healthcare professionals and by people licensed in other professions as well. It's destroying their ability to do what they're supposed to do and destroying their client and patient care as well. In our healthcare crimes unit, the federally funded unit that's kind of secretive and looks into Medicare, Medicaid abuse, we're prosecuting drug diversion in nursing homes and healthcare institutions all the time. And we're suing drug companies nationally for misleading the states and misleading consumers about the differences in the effectiveness of particular drugs for particular uses. In child support enforcement, which we do across the state, we have about 2,000 cases pending at any given time. We're seeing more and more deadbeat parents unable to support their own children, but still desperate to spend what little money they have on drugs. Our Child Protection Division, with several thousand cases pending at any given time, sees more and more family members who are too stoned to take care of a child. People operating dangerous meth labs in homes and sometimes cars where there are children. People overdosing in front of their children. This has happened all the time. People passing out on a couch or on a bed, not knowing, not being cognizant that their infant is lying next to them or under them. In our criminal division, with a team of 8 drug prosecutors, we're prosecuting drug felonies across the state. And our caseloads have increased exponentially with so many more heroin, fentanyl, and cocaine cases in recent years. Heroin and opioid arrests and prosecutions are up 300% in recent years. And last year, 40% of the drug task force cases involved heroin or fentanyl, up from only 8% in 2012. And then we've prosecuted so many drug-related murder cases in year after year, 5 in 1 year alone recently, including the terrible case in Bangor, where 3 bodies were found. It turned out to be 3 young people shot and killed and burned to death by 2 out-of-state drug dealers. And after a very intensive and lengthy investigation, using cell phone location data and other technology, we managed to prosecute those individuals after a 3-week trial, and they're serving lengthy sentences in our prison. In our Natural Resources Division, you wouldn't think they'd be dealing with opiate stuff, but they're addressing the question of the proper disposal of unused prescription drugs and illicit drugs that are seized by law enforcement. Substances with the potential to contaminate drinking water and lakes and streams. Finally, in the Office of the Chief Medical Examiner, which is in my department, we supervise the investigation of non-natural deaths, which more and more frequently are drug-related. And it's from that office and from the research we contract for with Marcy Sorg of the Margaret Chase Smith Public Policy Center that we obtain the sobering data about overdose deaths in our state every year. So I want to talk to you about the opiate crisis in Maine today, but I'm almost afraid that you've already heard too much about it. The causes are complicated, the cure is distant and uncertain, the prognosis depressing, the numbers staggering, and the challenges sometimes seem unsurmountable. But I do want to mention, too, the good work of Gordon Smith and U.S. Attorney Tom Delahanty and Commissioner Morris, who are working with me in my office to address this problem through the Maine Opiate Collaborative. Through its 3 task forces on prevention, harm reduction, treatment, and law enforcement. And I want to applaud what Quality Counts and so many others in the medical community are doing to diagnose substance abuse disorders, to prevent them from taking hold, and then to treat them once they've set in and begun to unravel a person's life. Obviously, the most important thing is prevention and education. Because once someone is addicted, it takes a lifetime of effort to prevent permanent relapse. And we're working with people like Skip Gates, who are bringing the message into the community and into the schools. Skip lost his son to a drug overdose, probably his first time trying heroin, snorting heroin as a freshman at UVM a few years ago. Brilliant young man. And Skip speaks emotionally and effectively about that to school children of all ages. As for law enforcement or interdiction, we know that for every drug trafficker who is arrested today, bringing thousands of bags of heroin up from Brooklyn or the Bronx or Lawrence or Lowell, for every one of those business entrepreneurs whom we detest, 10 more will probably take his place tomorrow when we arrest that person. The supply will always meet the demand somehow, some way. I know we cannot arrest our way out of this problem, though, and I'm not an advocate of the old-fashioned war on drugs paradigm. But at the same time, we cannot address this problem without arrests. So it's a constant battle to investigate, slowly and surely, in the underground economy, the underground crime wave that we're seeing in our state and elsewhere, and successfully prosecute these people federally and state, put them in prison. We don't celebrate too many wins and victories, and there are, however, a few strong individuals like young Matt Braun who have had the courage to tell their stories of survival and who've had an impact, a real good impact on people of all ages. And we have some success stories in our drug courts, our co-occurring disorder court, and our veterans court. With drug courts now operating in 6 counties, with intensive attention by judges, you know, as expensive and as intensive as these courts are, every dollar spent on adult drug treatment courts in Maine generates about $1.87 in savings to the state's criminal justice system, with a recidivism rate of only 16% compared to double or triple that for those who don't participate in drug courts. But the fact remains, the easiest drug addict to treat is the one you've prevented. So with a view towards prevention and education, let's talk about some of the stark statistics. In the last 6 years, more than 1,000 people have died from prescription drug overdoses in Maine. I think there's a slide. There it is, look at that. This is overall drug overdoses, not just prescription drugs. Last year, there were 272 overdose deaths in Maine. 111 of them from prescription opioids, and that was an increase of 31% over the number of deaths the year before. With 189 opiate overdose deaths the first half of this year alone. That's an increase of 50% over the first 6 months of last year. 189 the first 6 months of this year. We are on track to reach as many as 378 or more overdose deaths by the end of this year. That's more than a person a day dying because of drugs in our state. One every day. America's drug crisis now kills more people each day than car crashes or gun violence. We have never had as many deaths from traffic accidents in Maine as we had from drug overdoses alone last year. Never. The highest number of traffic deaths we've ever had in 1 year in recent decades was less than 200. And yet we had 272 drug overdose deaths last year. Those who die from drug overdose come from all walks of life. They include people of all ages. In 2014, the people who died were people from ages 18 to 88. 18 to 88. The median age was 43, which is the same median age of the population of Maine. Much of the increase in overdose deaths is due to the widespread use of powdered fentanyl in the last year and a half, which is not the fentanyl used in nursing homes and hospitals, but an illicitly manufactured drug that is many times more lethal than morphine and many, many more times lethal than heroin. Illicit fentanyl and its chemical analogs caused 44% of the deaths in the first 6 months of this year. 44%. Fentanyl, as you may know, is often mixed with or presented to the user as heroin. The user may have no idea what they're injecting or that it is such a deadly, deadly substance. Alcohol is still also a contributing factor and a prominent part of the substances listed on death certificates as either a cause of death or a contributing factor in drug cases. It's named in 20% of all the cases of 2009 to 2015. And at the same time, the use of prescription drugs remains high. While heroin and fentanyl have gone up, prescription drug as a contributing factor or cause has remained level, not gone down. Roughly the same as previous years. So at least one pharmaceutical drug is named as a cause of death, alone or in combination with other drugs, in the overwhelming majority, about 85% of drug deaths in Maine in 2009 to 2015. Most of these prescription drugs have been diverted, illicitly obtained. A very small minority have been prescribed but misused by the patient. An overwhelming majority of pharmaceutical opioids and benzodiazepines that are implicated as causing or contributing to overdose deaths since 2009 lack any evidence of a prescription. Of the 96 cases last year in which a pharmaceutical opioid was implicated, for instance, only 7% had a prescription for that drug. I received one report from the medical examiner last year about a 44-year-old woman found dead on her bathroom floor with cut straws in her pocket and under her body, a box of Suboxone nearby. Cause of death was listed as accidental overdose of fentanyl, acetylfentanyl, heroin, diazepam, duloxetine, zolpidem, buprenorphine, and lamotrigine. Where did these come from? I wanted to ask, who prescribed any of those prescription drugs for her? Where on earth did she get all of them? So while we still focus on heroin and fentanyl in the news releases and the obituaries sometimes, prescription drugs also still remain much the problem, both as an addictive gateway to harsher, more deadly drugs and as a contributing factor or cause in overdose deaths. We're told, of course, that at least 80% of those addicted to dangerous substances such as heroin started down that path by being prescribed a painkiller such as oxycodone. I know Gordon and Carol are going to talk later on about LD 6046, now Public Law, Chapter 488, the new law that limits opiates and benzodiazepine prescriptions. And I want to give the governor credit for putting that bill forward. I fully supported it. Under that law, Maine will be, I believe, the first state in the nation to require three things: daily dosage limits on new prescriptions for opiates and benzodiazepines, durational limits on those prescriptions, and mandatory checking with a prescription drug monitoring program before writing those prescriptions. We also know that Maine leads the country, this is one reason for the bill, leads the country in the rate at which we prescribe long-acting opioids like OxyContin. 1,224,629 prescriptions were written for opioids in one recent year alone to 335,990 people in Maine. That's a quarter of our population. 81,743,690 opioid pills dispensed in 1 year alone, just in Maine. In 2014, there was an average of 60.4 prescribed narcotic pills per person, per capita in Maine, with the lowest numbers of pills prescribed in Cumberland and Franklin counties, go figure, and the highest number prescribed in Kennebec and Somerset counties. Nationally, the United States is 5% of the world's population, but we consume 97% of the world's hydrocodone and 82% of the world's oxycodone. Let's remember why. As outlined dramatically in the book Dreamland by Sam Quinones, the development of oxycodone is a harmless panacea for pain relief. The pain management paradigm that created pill mills across our country and the atrocious marketing campaign by Purdue Pharma, which led prescribers everywhere to believe that oxycodone was harmless and not addictive, all led to the massive overprescribing of these painkillers for all sorts of ailments and the subsequent addictions to these drugs and then to heroin and other illicit drugs. I want to remark that Steve Rose here in the audience, when he was Attorney General, joined the lawsuit against Purdue Pharma 10 years ago and helped bring them to justice at that time with the help of the federal government. There were guilty pleas to criminal charges at that time and massive amounts of money paid on behalf of because of their bad conduct. Now, though, the most recent data about substance abuse among high school age youth indicates still that 1 in 10 high schoolers have misused prescription drugs in their lifetimes. And the rates of use are highest among adults 18 to 35 years of age. Non-medical use of prescription painkillers is higher among adults ages 18 to 25 compared to adults older than that. And again, we know that at least 80% of those addicted to dangerous substances like heroin started down that path with prescription drugs, taking them from a family member's medicine cabinet or otherwise obtaining them. Fentanyl, heroin, and prescription painkillers are exacting a tremendous toll on our state, and the figures are very distressing. People have got to be aware that there is no safe amount to sniff or snort. There's no safe party pill, and combinations of these things are lethal. As a result of these horrific figures and our observations across our office, I've started a website called doseofrealitymaine.org to share information about the safe handling and disposal of prescription painkillers, which are too often abused and which lead to addiction. And we've produced a series of public service ads on TV stations around the state. I'm working on getting similar messages up on social media because I know that that's where you get people under the age of 40. Let me give you some examples. And how do I do this? Maybe you can get this.
Hey, wake up.
Hey, Brittany. Does anybody know how many pills she took?
I don't know. Should we call 911?
No way, we'll get in trouble.
You guys, I don't think she's breathing.
How long has she been there like this?
I don't know.
What do you mean you don't know? Are you watching her?
Weren't you?
No, I'm not her babysitter.
Brittany, please wake up.
Brittany, how many pills did she take?
You guys, we can't just leave her like
No, we
this.
gotta get out of here. We gotta get out of here, let's go.
As you can imagine, that party scene is happening all too often in our state, and people are confusing respiratory distress for simple snoring, passing out, when the person's actually dying. See another one.
So you think he's framed it?
Oh, yeah, definitely.
That's what I thought. Dude, just take these.
What are they?
Don't worry about it. They're just painkillers I took from my dad. You know, I took a bottle and keep it in my locker, just in case.
Sounds good. Thanks, man.
Hey, don't thank me. Thank my dad. He has so many bottles, he can't even keep track.
And this is exactly why we have Drug Disposal Day, or like we had last Saturday, Drug Take Back Day. Get those pills out of people's medicine cabinets. This is happening every day in our communities too. Finally, one more short one.
Mike, I'm heading out to run some errands. Better get out soon. Mike, don't you have to go to work? Mike, honey, are you listening to me?
Mike, get up! Mike, wake up! Michael, get up! Honey, get up! Mike, baby, wake up!
So, those are up on TV, and I hope they hit home. I hope they'll spark conversations in homes and schools across Maine and educate everyone about the importance of proper handling of painkillers before tragedy strikes one more Maine family. My office has also recently used funds from pharmaceutical settlements to purchase Narcan, which we're distributing to all police and sheriff's departments who want it. We've now distributed 968 doses of Narcan to 34 different law enforcement agencies. It's just that one little nose spray, very easy to use. Just in the last few months, we've saved 33 lives. In addition to the number of deaths from overdoses, though, there are the emergency room visits, the ambulance and EMT responses. The number of EMT responses to apparent opioid overdoses last year was 3 times the number of the year before. There are the efforts to seek treatment. The number of people seeking treatment for opiate abuse has jumped from 1,115 to 3,464. It's tripled in the last 5 years, many of those people without insurance. And there's the frustration and helplessness of families and of police officers who see the same drug-induced dynamics, death, deadbeat behavior on the streets of their towns every day, every night, and they're becoming numb to it. There's a cost to our children, too. 3 babies a day born affected by drugs in Maine. 1,013 last year alone. More than double the number just a few years ago. 8% of all live births in Maine are babies affected by drugs. Never mind the social and emotional hardship of that. In addition, the estimated cost of these drug-affected babies is an average of $32,016 per child, compared with the post-delivery cost of $1,400 to $4,000 for non-drug affected newborns. Excuse me. It's taking a tremendous toll on our communities. And yet our public health system is being torn apart, dismantled, the number of public health nurses cut in half in favor of some sort of laissez-faire health policy. At the state level, I'm sorry to say that we seem to be lacking any direction. There's only blame and finger-pointing. There's no leadership. No single individual in this state is in charge of addressing this crisis. So we talk about the 3-legged stool of prevention, treatment, and interdiction, but the efforts are scattered. Even though the legislature came together last January and supported a bill to provide 10 more treatment beds in Bangor, it hasn't happened yet. We hired the 10 new agents, but we haven't got the additional treatment beds. You know, if a 3-day blizzard hit this state and we all lost power, I think we know someone would be in charge of that emergency and responding to that emergency. If, God forbid, we suffered an outbreak of chickenpox or the Asian flu, I hope we would know someone was clearly in charge of prevention and treatment of that epidemic. If a dozen baby seals washed up on the shore on the beaches of Cape Elizabeth, the entire state would be outraged. People would be marching in the streets. Folks would stop what they're doing, and the news cameras would be focused on that, for that story alone, for weeks at a time. But these aren't baby seals, or eagles, or hurricanes, or blizzards, or the chickenpox, or the flu. This is another kind of epidemic. And we're silently growing numb as the health and sanity of our citizenry is diminished, and our communities and families are quietly torn apart. We become inured to this epidemic. We become anesthetized from repeated news stories about this scourge. Last week, I was driving my niece to school, and I happened to look over across Deering Oaks, and I saw an ambulance and some police cars. I just knew it was an overdose. I had that feeling. And later, I knew I was right. It's become an everyday occurrence. Chief Sawchuk estimates that 75% of the crime he sees is due somehow to drugs. As opioid abuse grew over the last decade, drug-crazed individuals have robbed pharmacies, robbed each other, robbed families and communities of their safety and security. There were 56 pharmacy robberies in 2012 alone. Small children have died due to neglect while parents shoot up heroin or overdose on OxyContin in the next room. One of the overdose deaths last year was a man who took his son trick-or-treating, and on the way home, stopped to buy some heroin. Turned out it was laced with fentanyl. When he got home, he shot up and he died with his child in the room. In January, a guy was driving around the city of Portland, snorting heroin, while driving, he almost drove right into Portland Harbor off Commercial Street. But he ran into Rera's bar instead, with his 5-year-old son in the back of the car. In York County last week, a man required 5 doses of Narcan after taking an overdose of what turned out to be carfentanil, an elephant tranquilizer. And then yesterday, there was news of a car wreck on the airline, Route 9, in which both the driver and the passenger were found unresponsive from suspected drug overdoses. drugs in the car. Both were passed out. Thank God there was no oncoming vehicle with an innocent family in it. Well, what can we do? We need to keep working together, read and understand the report of the Maine Opiate Collaborative, participate in those public forums, learn what's happening in your own communities, lobby for better treatment options at every level. What can you do as employers? Well, you can institute employee assistance programs. They're non-judgmental, they're treatment-oriented. You know, we have a law on drug testing in the workplace. It's a pretty good law, it's worked out for employers of more than 20 employees. You can institute that kind of program, and when there's a bad test, get somebody into treatment, into an employee assistance program. You can, as health professionals, you can become familiar with the new law that Gordon and Carol are going to explain later today. You can implement the recommendations of the CDC prescribing policy and Scott Fisher's book, Changing the Paradigm of Treatment of Pain. It's a change in practice, a change in paradigm, a change in culture, but it must be done. You can adopt uniform policies within your communities. The Penobscot County area has done that. So all the docs are talking to each other, all the medical professionals are saying, we're doing it this way. Can we be consistent so there won't be that doctor shopping that pain seekers often engage in? Stick with those policies. Encourage partial refills, now allowed specifically by the law. So the pills aren't sitting around waiting to be stolen or misused by your son or daughter or neighbor. You can post a warning in your offices. It just says, not just take only as directed, but tells people to keep that drug in a secure place. Tells them that letting anybody else use the drug is a crime and can make somebody sick or even addicted. That taking too many of these pills can make you sick or addicted. So ratcheting back on prescribing painkillers is one very important effort. Adopting workplace drug use policies and employee assistance programs are vital as well. And then there are things all of us can do, like bringing this problem out in the open, destigmatizing it. It's an illness we're talking about, not just a criminal justice problem, but a health problem, public health problem. We need to talk openly about the dangers of substance abuse and the false idea fed by the media and the constant messaging from pharmaceutical companies that there is a pill for everything. That whatever ails you, whether it be a sore ankle from a football injury, or getting jilted by a boyfriend or girlfriend, or losing someone you love, or not getting the job you want, or becoming disabled and eligible for Social Security, or just not generally feeling happy in life, that there's a pill that will make it all better. We've got to reject that idea that is so embedded in our cultures. We need to talk openly about those communities who have lost people, shedding the stigma and the taboo that stifled these voices in the past. Talk openly, as Jamie Higgins of the Scarborough Police Department has done in recent weeks, about her own brother just lost to heroin overdose. Jamie is the person who's out there at Project Hope, finding treatment options for people who walk into the police department. Finding them, unfortunately, in Texas, Florida, and Massachusetts, not in Maine. Getting scholarships for people who can't afford to get there, can't afford to pay the treatment. We're having bake sales to provide treatment options. We need to identify the precursors of substance abuse, adverse child experiences. We need to provide the needed treatment and expand Medicaid to do that, to provide health care coverage for substance abuse treatment. You know, even Governor Kasich, the Republican governor of Ohio, did that. He expanded Medicaid in particular in order to address the substance abuse epidemic. And housing and job training to rehabilitate the souls who have succumbed to substance abuse. Now, we need to identify the adverse childhood experiences, which is a difficult, painstaking thing to do. Identify the personality traits that lend themselves to substance abuse disorders. And we can implement early intervention programs, such as those described in yesterday's Portland Press Herald's editorial, the Preventure program that involves personality testing, identifying risky traits of behavior, sensation-seeking, impulsiveness, anxiety, sensitivity, and hopelessness. The parents of one individual who overdosed in another state said, quote, they say it takes a community to raise a child. Well, it takes a community to battle addiction. It's a slow process to change a whole culture. but change we must. It's not going to just go away like last year's blizzard. At the end of the book, Dreamland, the author talks about the idea that has taken hold in our country that we should be protected from pain at all costs. That consumption and the accumulation of stuff is the path to happiness. The isolation that we've built into our suburbs and our communities, calling it prosperity. And the expansion of technology that connects us to the world, but that separates us from our next door neighbors. He concludes saying, why then do we wonder that heroin is everywhere? He says, in our isolation, heroin thrives. That's its natural habitat, and our very search for painlessness leads us to it. Heroin, I believe, is the final expression of values that have fostered for 35 years. It turns every addict into narcissistic, self-absorbed, solitary, hyper-consumers. A life that finds opiates, turns away from family and community, and devotes itself entirely to self-gratification by buying and consuming one product, the drug that makes being alone not just all right, but preferable. I believe, he says, more strongly than ever before, that the antidote to heroin is community. If you want to keep kids off heroin, make sure people in your neighborhood do things together, in public, often. Form your own dreamland communities. Break down those barriers that keep people isolated. Don't have play dates, just go out and play. Bring people out of their private rooms, whatever forms those rooms take. Pursuit of stuff doesn't equal happiness, as any heroin addict will tell you. People in some places I've been, they emerge from this plague more compassionate, more grounded, more willing to give children experience rather than things, and show them that pain is part of life and often endurable. The antidote to heroin may well be in making your kids ride bikes outside with their friends and letting them skin their knees. So, no easy answers. My mother always said, leave your room cleaner than you found it. I think she was saying, leave this world a little better than you found it. Together we can do just that. Thank you. We have time for a couple questions if you have any, or I'll be around for coffee too. So. Hi, yes.
We're talking about giving the lockdown to
Please.
emergency room people or people kids.
Yes.
Has it ever been considered to get it to people in public places, libraries, places where it's make it easier to get access? I know that in Connecticut, pharmacists can actually prescribe and dispense naloxone to people. And I think those programs have not answered the problem, just answered to the deaths.
You're correct, and we've had schools asking for it, and that's a sad state of affairs, but it's been a political battle in Augusta. Many legislators have Linda Sanborn is one of them, she's right there, have pushed for greater access to naloxone, Narcan. It's not something that's going to be abused, and we've had veto after veto. And this past year, there was a bill to expand prescription access to it over the counter for family members and people who feel they might need it. It did. Right. Board of Pharmacy has to do rules so they can dispense them. I've got some in the back of my car. And it's so simple, and you're not going to screw it up. Anything else? Well, thank you.
Thank you. I'm going to continue on this theme for a minute before introducing Judy Ann Smith from the Hanley Center for the purposes of presenting a very special award. I just wanted to remind you that in keeping with the theme that there's something that all of us can do, there are another series of community forums that have been generously supported by Steve Rowe through the Maine Community Foundation and Barbara Leonard. Barbara's here somewhere, the new president of the Maine Health Access Foundation. And those two foundations have been very generous in supporting this type of activity, and a lot of people think that it's replacing what the state ought to be doing, but isn't. So if you are in the areas in the next few days of Wells tonight, Dover Foxcroft tomorrow, Norway and Machias next week, and we were in Belfast. I attended the Belfast Forum 2 nights ago, and we had a forum in Rockland last night. This follows up on 22 forums that we had earlier in the year, all facilitated by our able facilitator, Carol Kelly, who I saw right here. So there is a lot going on, and community probably is an answer. Those forums are designed to lower the stigma attached to addiction, to have people have a better understanding that it is a chronic disease, that people suffering from substance use disorder will, in fact, live with it for the rest of their lives, and that it really, at the end of the day, is about prevention and treatment. The medical community stepped up to the plate, supported the governor's bill with amendments, and it's the toughest law in the country. The Attorney General, it's not her role to talk about the difficult balance that there is, and the patients that call me every day who believe at the high mega doses that they're getting that pain medication is keeping them working, keeping them able to take care of their children or grandchildren. I'm not a physician, I'm just a lawyer. I know nothing about medicine, but I'm able to channel what people have told me, and I explain to those patients, many of who have been sent to me by legislators who supported the bill and now are getting calls from those 16,000 patients in Maine who exceed the maximum daily dose that took effect on July 29th. So it's not an easy thing to change that culture, and those patients believe that this medication is keeping them pain-free or helping them with their pain, when in fact we know from the literature that it's killing them. To give you just one example, and again, all I'm doing is channeling my friend Lisa Letourneau over there that is doing a project with the Maine Medical Association and Maine Quality Counts called Caring for Me, ME, which is all about compassionate implementation of Chapter 488. But to give you an example, I borrowed this right from Dr. Letourneau's slides. If you are at our maximum daily dose is 100 milligrams of morphine equivalent. And as I've said, 16,000 patients exceed that limit now and are being tapered by their patients, or they're being tapered by their physicians, always looking for an exception. At twice that limit, at 200, you have a 1 in 32 chance of dying in the next 2.5 years. Those are odds that we're not really used to in medicine, 1 in 32. Well, last week I had a nurse practitioner call me from a rural part of the state who had inherited a patient from a physician who had left that practice. And that patient was at 2,000 milligrams, 10 times the dose at which you have a 1 in 32 chance of dying. Now that patient, I have no doubt from what the nurse practitioner was telling me, absolutely believes that medication is keeping him alive, but it will probably kill him. So we've got just a huge job to do. But I think that the medical community may be kicking and screaming, but nonetheless is coming into where it needs to be. But you can all do something. And if you go to these community forums, we talk about, at least 10 different things that every citizen can find one thing on this list to do. You can mentor a young person in middle school because we have so many that don't have have important adults in their life. You can contribute to the local recovery center. You know, there's something that each and every one of us can do, and I encourage you to do that. My last story before I go on is just the lack of treatment facilities in the state. So the only detox beds in the state are in Portland, and they've been very generously offering those beds to people around the state. But in Machias, which is not next door to Portland, many of you know where Machias is. There's a terrific abstinence-based program there called Arise, and when the emergency room sends a patient over to Arise, they come to Portland for their detox beds for better than 4 hours. Now, there are 10 new beds that have been contracted through the state to be put in Bangor, so then they'll only have to travel 2 hours. But they need 3 or 4 detox beds in Machias. It's not that expensive, but you would think we were trying to build a $10 million facility. So we need everything. We need more Suboxone providers, we need more methadone clinics, we need more detox beds. And so that's another thing that those of you in medicine can help us with. So it's been a very sobering topic to start the morning with. So now we'll transition to some happier topics. It's a real pleasure to introduce Judy Ann Smith, who's the Executive Director of the Hanley Center for Health Leadership. Many of you in the room know about the Hanley Center and its work in collaborative leadership. It's named for Dr. Dan Hanley, who was Executive Director of the Maine Medical Association from 1955 to 1979, but also continued on to run the Maine Medical Assessment Program. Dr. Hanley's collaborative leadership style is something that we try to channel every day at the Maine Medical Association. And so we're very proud to be a part of the Hanley Center, and very proud that the Management Coalition asked Judy Ann to present its collaboration award. So I know she's sitting nearby and standing nearby, so she's become a good friend, and then she's just celebrating her first anniversary taking the job when Jim Hahn retired. So Judy Ann, podium is yours.